Hello everyone, my name is Caroline Sonnet. My group member are Fem and Cielo Sanidad. Today we will giving you an introduction to AIDS, how AIDS transmit in and out of the dental office, proper infection control and other methods to prevent and cure for AIDS. Introduction. What is AIDS? AIDS is final stage of HIV. If HIV is left untreated, it can progress to AIDS within 8 to 10 years. Occurs when body has been severely damaged by the virus, loss of immunity cell, significantly lower resistance to infectious disease and virus. There is currently no cure for AIDS. Your mouth may be the first part of your body to be affected when infected with HIV. Signs and symptoms: sweat, chills, recurring fever, chronic diarrhea, weakness, and weight loss. Swollen lymph gland, persistent white spots or unusual region on your tongue or in your mouth. Persistent unexplained fatigue and skin rash or bumps.
AIDS in the dental office. What should we know and be aware of? AIDS can spread through direct contact and indirect contact. Direct contact through blood, oral fluids, and other infected items, and indirect contact when pregnant mothers can pass HIV to their babies during childbirth or breastfeeding. The contact/transmission of AIDS includes needles, sex, blood transfusion, pregnancy, breastfeeding, or delivery. And then the common infections with AIDS include oral candidiasis, which is otherwise known as oral thrush, tuberculosis, cytomegalovirus, or hairy leukoplakia, xerostomia, otherwise known as dry mouth, red band gingivitis, ulcerative periodontitis, ulcers, and canker spores.
Infection control. What is it and how to do it? Some infection control standards include, but are not limited to, the following. Personal protective equipment, which is like protective clothing such as gowns, gloves, face shields, face masks, or any other items made to protect a person from injury or spread of infection or illness. It also includes personal hygiene, which is like washing your hands, taking showers, brushing your teeth, because outside germs and viruses can linger on your body. It also includes universal precaution, which means that all patients are considered potentially infectious with viruses or diseases such as AIDS, HIV, and hepatitis B. So remember, it applies to all patients. And then lastly, it also includes disinfection, which needs to be properly done using chemical disinfectants and the wipe, discard, wipe method during operator setups, in between patients, and breakdowns. Remember, it is easier to prevent surface contamination than it is to disinfect a surface. So this includes prevention, which includes the usage of surface barriers. So infection control within the dental office. It is crucial to practice the proper infection control within your dental office. So this can include flushing your water lines for 2 minutes before and after the patient and 20 seconds in between them. The usage of high-level disinfectants that have a tuberculocidal kill time in order to destroy microbacterium, but it doesn't necessarily kill spores. And then a patient should use an antimicrobial mouth rinse for 1 minute before starting any treatment. You should also be using disposable barriers to cover any surfaces that will be used or touched during your treatment. This includes semi-critical and critical items. And you need to be organized by being prepared and tidy in order to minimize cross-contamination, aerosols, and spatter. It's also important to use the scoop technique, which is recapping your needles for sharp safety, and the needles should not be bent or broken for the purpose of disposal. Okay, so sterilization. Disinfection is not sterilization. So sterilization actually kills and destroys all bacterial spores, and a verification of proper sterilization should be done weekly through biological indicators such as spore tests, and the test results need to be recorded and kept for 12 months, so a year. So prevention and care, what the patient should know about living with AIDS. The best ways to prevent any issues are for the patient to notify by visiting their dentist for regular scheduled appointments, brushing and flossing twice daily for 2 minutes, taking their HIV medication on schedule, and if there's any concerns, make sure to tell the doctor, such as HIV causing dry mouth xerostomia, and ask what type of treatment is best for them. And if they don't have a dentist, have them ask their primary care provider for a clinic to get a referral. And just a quick statistic, approximately 38 million people are currently living with AIDS or HIV. Thank you, and here's our works cited.